Well, we put them on a gluten-free diet. So we're going to conclude with this case study here, which is super cool. And so this individual here came in, they had dyspnea and chest pain, a lot of discomfort in their chest, and they had had a previous heart stent procedure. And so they refused to go to their cardiologist. I told them, well, hey, you had a heart stent. You need to go back to your cardiologist. At this point, they didn't want to go back right now. We did some testing. And on the testing, you can see that their A1C, their first reading was an 8.8. And they've got some other elevations. Their ferritin levels were elevated, and they have some liver enzymes elevated. On retest, you can see just several months later, their A1C, their blood sugar number, down to completely normal ranges on their A1C. They're no longer in diabetic range. And also any chest pain they had before is gone. What did we do with them? Well, we put them on a gluten-free diet. If you have not done a gluten-free diet, you should be trying a gluten-free diet. And most people, if you have them cut out gluten, at least for 2 months and just trying that out, you might be amazed at what that's going to do for your joint pain, for your tummy, for your hypertension. You might be amazed. And he came back, like I said, and his values had improved out of diabetic range. And here he is 2 years later. And guess what? His glucose levels are still out of diabetic range. He's much better. And of course, his blood pressure is down into normal ranges. No blood pressure medication whatsoever. He's had stable labs for 2 years. But in this incident here, this time, we did not actually treat a condition. We actually gave his body what it needed and took away what it did not. Now, sometimes we know what the body doesn't need.